I went to my dentist appointment. I was just having a regular checkup, and they told me I've definitely got a more serious problem than anything with my teeth. My right carotid artery, it was glowing just like one of the crowns in my teeth.
Mark came to us through the hospital. He was referred by his dentist, who apparently had found some calcification in an artery in his neck and was concerned that he may be at risk for stroke. We found that he had significant blockage in his neck. His risk of having a stroke in the next few days was highly likely.
Dr. Heide took over and actually diagnosed him with advanced vascular disease and prevented him from having a massive stroke.
To him and that dental hygienist, those guys saved my life. Kind of like my guardian angels, really.
Mark was actually referred by his dentist to the ER because of a general dental x-ray.
I was just having a regular checkup, and my dentist and my dental hygienist discovered that I had a major blockage in my right carotid artery. I've got 2 kids I gotta worry about. I didn't really want to take any chances. My gut was telling me something was up.
He did listen to his dentist and came to the hospital.
I went through probably a dozen doctors, and they weren't really taking me seriously. I finally got a nurse where she called Dr. Heide, who immediately said, don't you dare let that guy out of there. Go ahead, do a CAT scan on that thing, and then call me back. Did the CAT scan, and then I could see it was 80% blocked.
The scans luckily did not show that he actually had a stroke yet, but if we didn't do something to fix that artery, his chances of stroke were high. We needed to fix that artery immediately to possibly save his life. We underwent what's called a carotid endarterectomy, and we cleaned out his artery, and he recovered quite well with no side effects.
Carotid artery disease is, according to the American Heart Association, the #2 leading cause of stroke in this country. The carotid artery disease is a buildup of plaque. In Mark's case, it was actually a calcified plaque, which was the actual deposit of hardening in the arteries.
The calcification usually indicates that there's some damage to the arterial wall. And the more damage to the arterial wall, the more calcification builds up over time. I think it's actually found quite often with regards to the x-rays. There's several studies that demonstrate at least 11% of the patients that visit dentists will end up with calcifications on x-rays. And it actually doesn't take much calcification to signify a significant risk of stroke, but not just stroke, but high blood pressure and possibly a pending heart attack. If you catch calcification on an x-ray, just because there's a little calcification doesn't mean it's not a significant problem. So sometimes this can actually mean that there's the early stages of clot formation, which means it's the easiest chance for the plaque to rupture and actually form a big clot and result in stroke. Especially with the case of Mark. I believe if his dentist didn't send him in for evaluation, he would have had a large stroke within days.
If I didn't see Dr. Heide and I walked out of that hospital, if I didn't die, I would have wound up being paralyzed on my left side, half blind if not fully blind, and incontinent.
So this is why we're trying to commend that when we have people who are found to have calcification on their x-rays in their neck, I believe it's very important to get an ultrasound to make sure there's no significant clot that actually could result in a stroke.
The ultrasound for checking carotid arteries, it's nothing. And it's such a simple test that can save your life.
In the case of Mark, we use carotid ultrasound to follow him up after surgery. The carotid ultrasound is the only real-time imaging technique available to us to see the artery in progress and disease without doing anything invasive to the patient. Dr. Heide as a physician is very caring, compassionate, and thorough. His attention to detail and looking for advanced disease in patients is by far one of the greatest I've ever seen in a physician. Dr. Heide and I both have decades of experience in the neurovascular area. I'm one of 2 registered vascular specialists that actually practice in Northern Nevada.
I'm a general neurologist and vascular neurologist with specialized training in evaluating, treating, and prevention of stroke. I'm the only fellowship-trained stroke neurologist in Northern Nevada.
They're a good team. I know they've been working together with each other for years. Just tell how competent they are. I'm happy to have them.
I have had patients who have had these findings before, but I usually see them after they've had their stroke. And so what we're trying to do is actually trying to prevent many, many strokes. I believe that we can significantly reduce the risk of stroke if we can have a close collaboration with the dentists of our community. The best medicine is preventative medicine. In fact, the recent American Stroke Association statistics suggest that there's over 800,000 strokes a year in the United States. And the thing about strokes is that they don't often kill, they disable, which increases significantly, not just to the cost and discomfort and disability of the patient, but the cost of our medical society and society in general. When you see calcification on the x-ray, or you have a patient who has any sort of symptoms that we're concerned about, the sooner the evaluation, the better, because we can have more situations where we save patients like Mark. I believe that this issue is so significant and the volume is so great that I'm doing this not just as an educational point, but also as a call to action to allow dentists to have a conduit and a source of information and place of referral.
Wanting a doctor to be my advocate. Dr. Heide did excellent. He's one of my best doctors I have now. If it wasn't for Dr. Heide, I probably wouldn't be here today.
This is such a large public health issue that having such a low threshold for referral or findings is very important. Even if there's a small chance that you're seeing something on that x-ray, I believe a referral is worth someone's life.